Hello, and welcome to the Ovarian Club, a glimpse into conversations between two besties across countries, South Africa and France, tackling the trendiest women's wellness topics through a scientific lens. Join me, Dr. Taryn, and health expert Emma as we explore delicate subjects related to the women's health space. We started this podcast to share our conversations to help navigate the complex women's wellness world. We hope you enjoy the podcast and take away as much from it as we've enjoyed making it. The Ovarian Club, powering life, nurturing health, shaping sustainable wellness. So, my follicle friends, let's begin. How are you?
I'm good. It's a Sunday and I have the Sunday scaries and I'm a little tired, to be honest, but very excited to chat today. How are you doing?
I was just about to say, inserts carte blanche music. It's like the soundtrack to my Sunday evenings. I'm okay. I'm actually dipping into my luteal phase, which we'll definitely talk about because I'm sure most of the listeners don't know what that means. But after listening to this episode, you certainly will know what it means. But yeah, I'm dipping into the luteal phase. So I'm feeling a little bit low-ish, symptomatic as well, a bit of bloating. Slight mood symptoms, not my usual bubbly self, but I'm okay. I'm hanging in there. I'm fine. And I'm really excited to talk menstruation with you all today.
I'm sorry to hear that. I know how shitty it can be. And the good thing about it is that you know that it will pass and that you'll move into the next phase very soon, which we'll chat about. But I know once you're in the thick of it, it is very overwhelming and all consuming. So sorry to hear that.
No worries. It's life. It's all part about being a woman, I guess. Something really interesting happened last night. I was out for dinner with two girlfriends and I was telling them how I was preparing for this chat with you today on all the different phases of the menstrual cycle. And I was really shocked to learn that my two friends, shout out to you girls, you know you are, they had no clue about the different phases of the menstrual cycle. And look, granted, not everyone is a science nerd like me or has an interest in medicine, or I get that, but I feel like there are some basic fundamentals that as a woman is so empowering to know about, because at the end of the day, it enables you as a woman to make informed decisions about your health. So I know my two friends are really excited to learn all about this, and I am really excited to share the principles with all our listeners.
Absolutely. Look, I think a lot of it also comes from the fact that menstrual cycles are, until recently, and even in today, in a lot of different cultures, it's seen as such a taboo subject. So people don't talk about menstruation, even though most women have menstrual cycles at some stage of their life. People don't talk about it. People do not discuss it. It is not an open discussion. So I think that also does explain to an extent why people don't understand the different cycles, what happens. And I have to be honest, like, I also don't fully understand. Like, yes, I did some research for this episode to discuss it with you, but there's a lot I didn't know about what happens with estrogen, what happens with the progesterone, what triggers it. And we'll get into it. So I'm very excited to talk about the different cycles of the period, to talk about what happens within the body. Also, what's normal, what's not normal, maybe what can we kind of watch out for. And then, of course, talking about PMS. What is PMS? What's that all about? You know, what do you need to understand about your body, about your mother, your wife, your best friend, whatever it may be, and some mechanisms that exist to help us to better manage our periods.
So before we get into it, I just wish to state two disclaimers. The first one, I'm not a specialist gynecologist. I'm a medical doctor who happens to have extensive experience working in the field of women's health, obstetrics and gynae specifically. So I did my community service training for 1 year at a really well-respected hospital based here in the Western Cape. So I'd like to believe I know a thing or two about women's health. The second disclaimer is that while I am a medical doctor, it must be declared that this podcast does not serve to offer any personal medical advice. So always seek the advice of your own healthcare professional with any questions you may have regarding a medical condition or treatment. Disclaimer's done, boring stuff out the way. Let's get into it.
So with that, I understand there's 4 phases of the menstrual cycle. Can you break it down in very, very simple terms what each phase is, how many days those phases potentially last for, and what is happening within the body from a physiological standpoint that makes these changes occur.
Cool. That's a great place to start. So, as you know, we've discussed in previous episodes, the brain talks to the ovaries, right? So when a girl enters into puberty, the switch turns on, and all of a sudden, the brain, the pituitary gland, starts communicating with our ovaries, and these hormones tell our ovaries to ovulate, right? So basically, where it all begins is the menstrual phase. This is when you menstruate. That's day one of the cycle, okay, which is on average 28 days, but there is great variance. We will unpack that soon. So day one is when the girl menstruates and typically lasts 1 to 5 days, but anything up to 8 days is actually considered normal. So this is when the uterine lining sheds, because pregnancy has not occurred. And then one enters into the follicular phase. Now, this is the phase when you are feeling your best. The build up to feeling your best, which would technically be when ovulation is, right? Because you're wanting to go out and find a mate. But the follicular phase is priming you for that. So basically, what happens is the brain tells the ovaries to start preparing for a new egg. And the little follicles start growing, and the estrogen is rising. And the estrogen is what I refer to as the confident hormone. Like, this is the time in my cycle when I feel amazing, so much confidence. I just want to go out. I am looking for a mate subconsciously. It's just incredible how the body works. And then the day 14 is when ovulation occurs, mid-cycle of a 28-day cycle, assuming that is your cycle, because as I said, it differs for everyone. And when this happens, the egg is dispelled from the main follicle that has been primed. And then only a dominant follicle is actually what extrudes an oocyte, an egg. And then this follicle transitions into what's called a corpus luteum. And then at this stage of the cycle, it starts releasing progesterone, which is what governs the second half of the cycle, called the luteal phase.
Yeah, I'm going to recap what you just mentioned. Menstrual phase is, say, day 1 to maybe day 7, 8. Okay, that's when the uterus lining sheds, you're bleeding. And then you go into your follicular phase, which is where you're kind of at your prime. You start thinking about going out, looking for a mate. If you're Taryn, you probably have like 7 different appointments and arrangements all in the same day. If you're me, maybe you have like 1 at the gym, but each one a different variation. You're feeling really good. You have a lot of energy. This is where you're priming yourself for ovulation, which occurs around day 14 of your cycle, so to speak.
Yes.
And that's when, the follicle releases an egg. And that is when you are ready for the egg to be fertilized and to have a baby, right? But if you don't have a baby, then you go into your luteal phase. Is that correct?
Yes, you summarized that perfectly. So then what happens is, after ovulation, if an egg is not embedded in the endometrium, the uterine lining, then progesterone essentially ultimately will dip. And then this is what triggers menstruation.
Okay. So that's when, like, if you are on taking like a contraceptive pill, for example, that's when you swap to the sugar pill. You're no longer taking progesterone and estrogen, that it dips down, and then that what could trigger bleeding.
Well, I'm really glad that you mentioned that, because it's actually very important to clarify that when one is taking a combined oral contraceptive pill, so that is combined synthetic hormones, estrogen and progesterone, you are actually experiencing what's termed a withdrawal bleed. And this is because you're not ovulating. You can menstruate in an anovulatory cycle. That's due to different mechanisms. But in the case of taking the oral contraceptive pill, you are undergoing a withdrawal bleed. So
what's a withdrawal bleed? That's just like not a real menstrual bleed.
yes, it's not a real menstrual bleed. It's because you suddenly go from taking hormones to placebo, so sugar pills, and then the uterine lining becomes unstable because of the decreased exposure to hormones, and then that just triggers a reflective bleed.
Okay, so it's not linked then to ovulation and getting prepared your menstrual cycle, okay? Which I think brings me on to then the next question, which is why do we menstruate, right? So why do we have a menstrual cycle?
Okay, so basically, well, firstly, do you know other animals menstruate? It's not just humans. The primates also menstruate. So great apes, chimps, gorillas, baboons, certain monkeys. Okay, so primates menstruate, but
Dogs?
non-primates, no. Dogs don't menstruate.
Okay.
It's confusing because they go on heats, right? But that is not the same thing as menstruation. So menstruation is actually really rare in the animal kingdom. And basically, during the estrus cycle, which is what happens in non-primates, look, I'm not a vet, but during the estrus cycle, from my research, this is the phase where females are sexually receptive and ovulation occurs. So going on heat is actually reflective of ovulation, okay? In dogs and cats and what have you.
But dogs do bleed,
and
though.
they bleed, but that's a sign before ovulation. They're not menstruating. Okay.
Okay.
Yes. So basically, they're them going on heat and bleeding. The females, it's a sign to the males that they are ready for sex. They're ready to get funky. So yeah, it's a signal to the mates that they are sexually receptive. Basically, if fertilization does not occur, the uterine lining is then reabsorbed in these animals rather than shed. This is thought to be an energy efficient mechanism. It prevents unnecessary blood loss. I mean, wouldn't that be amazing if humans had evolved this way too? So going back to then why humans undergo a menstrual cycle, this is because humans undergo spontaneous desidualization. And this is just a fancy term for saying that the uterine lining thickens before pregnancy happens in preparation for subsequent implantation. So basically, this happens because the maternal immune system must regulate which embryos subsequently implant to prevent defective embryos or overly demanding embryos from unnecessarily exploiting the maternal resources, right? The reason that humans have evolved to menstruate is because of the defense mechanism that happens whereby the body prepares itself, almost like overly armors itself as a shield against embryos because it doesn't want a pregnancy in a way, because it's so energy resourceful, so that it basically prepares a shield against an embryo from implanting. This is different from the case of other animals, which only undergo this process once the embryo has embedded in the uterine lining. Okay. So in humans, this happens before as a shield, and in other animals, it happens afterwards. So this is why it happens before as a defense mechanism, so that the embryos that do embed are genetically viable and definitely wanted by the body.
Okay. So then going into what is then considered a normal menstruation versus what is not a normal menstruation?
Okay. Yeah, this is a brilliant question again, and I think it's so important that the listeners all take notes. Like literally take out a pen and paper and take note of the following, because it's so important to know what's normal, what's not normal. So let's quickly go through the different parameters. Okay. Frequency. So how many days variance between each cycle? So as I said, the normal cycle is 28 days. Okay. But this is textbook, and we females, we're not textbook. So basically anything from 24 days to 38 days is considered normal. So if your cycle is every 24 days, that's absolutely fine. If your cycle is every 38 days, that's absolutely fine. Okay. What is abnormal would be anything falling out of that range. Okay. That's frequency. The second one is duration. As I said, anything less than 8 days is normal. On average, it's around 4 to 5, but up to 7, considered normal. More than 8, prolonged.
Of a menstrual cycle.
Of bleeding. Yes, yeah. This duration of the bleed, correct. Then, in terms of regularity, what is considered normal is the shortest to longest cycle variation is less then 9 days. So anything up to 9 days. And then the volume, the flow volume, what is considered normal? This is probably the most important part of my little lecture here. Volume is very much a subjective experience. And it's defined as a volume that does not interfere with a woman's physical, social, emotional quality of life. Okay, so if the volume, the blood loss, is impacting on one's quality of life, then it's not normal. Okay, so an easier way to explain this, if you're passing clots, large lumps, clots, I tell my patients bigger than a 2 rand coin, that should signal that something's wrong, right? If you're changing your tampon or pad more than twice throughout the night, you do have quite a heavy flow. Also, just bleeding in between periods, causing blood loss. All of this can result in an iron deficiency anemia. By far, the most common thing I encounter in my clinical practice is iron deficiency anemia, secondary to heavy menstrual bleeding. So very common. And I think it's just important to mention quickly here, the signs to look out for is fatigue, dizziness, palpitations, pica, so eating sand or soil. Yes, this happens, and patients do report it. It's not just in the textbook. And you're not weird if you resonate with what I'm saying. Headache, shortness of breath, anxiety. So yeah, just if you are resonating with anything that I'm mentioning now with regard to flow volume, you feel like you might be symptomatic for an anemia, or because you're bleeding more than 8 days, or you're bleeding clots, check in with a healthcare professional.
And what about spotting between your menstrual cycles? What is considered spotting? That could be normal. What is spotting, first of all? Can you explain that in terms of like medical terms? Is it just, like little drops of blood? Is it just discolored discharge? Like, what is considered also abnormal and what's considered normal in terms of spotting?
Brilliant question. Hormonal contraception can cause spotting and irregular bleeding, especially in the initial stages. So very important to clarify that first and foremost. So in the absence of hormonal contraception, what can cause irregular spotting? Well, firstly, pregnancy, then polycystic ovarian syndrome, which was our very first episode. It is by far the most common cause of irregular periods and spotting in between cycles, and is something that should be investigated. So if you are spotting in between your period, definitely check in with a healthcare professional. That's something I definitely want to emphasize. It's not normal. You should not be spotting.
And what is considered spotting?
I mean, just basically seeing a bit of blood on your panty liners. Just a brown, red, dischargey, yeah, almost like mimics a period, really.
Okay. And you said then also, if you are on the pill and you are having spotting, just to touch on that, and I don't want to go into too much detail, but that if you are on the pill or hormone contraceptive or whatever it may be, you said it's normal to spot. There may be this kind of breakthrough bleeding, especially if you're new to it. But what's considered like abnormal?
I'd say it depends on the hormonal method. So that's actually quite a loaded question, because external hormones absolutely can impact bleeding. So I think if you're concerned, check in with a healthcare professional. It's not such a straightforward question to answer. But for example, a hormonal intrauterine device that goes in the uterus, sometimes that takes away your periods, then you intermittently bleed here and there. There's nothing wrong with that. That's perfectly normal. So I think always just check in with a healthcare professional, and this same healthcare professional should counsel the patient on the potential side effects before administering or prescribing the hormonal method that's desired. So in the presence of hormonal contraception, spotting can be very variable. Okay. But going back to the pill, if you're on the pill by at least 3 months, it should be regular. And if it's not, I'd say check in. In the absence of the pill, okay, which is what we were chatting to earlier, basically it could be hormonal imbalances. So not just PCOS, not everything's PCOS. Sometimes stress, being very underweight. This can put a lot of stress on the brain ovary axis. And then if the brain's not talking to the ovary, you're not going to ovulate. If you're not going to ovulate, it's unlikely that you're going to menstruate regularly.
So if you have some hormonal disorders like PCOS, for example, you could have irregular periods or no periods whatsoever, but this can also be caused by weight loss or too much sports or stress or hormone imbalances. Yeah.
Yeah, I mean perimenopause also causes irregular bleeding, right? Due to the hormonal fluctuations.
And what about pain? So like I know I would like to talk about like endometriosis. What is normal in terms of pain levels? When you do have your period, what's normal?
Yeah.
What's up?
Yeah. So the term for painful periods is dysmenorrhea. And if it's impacting your quality of life, it's not normal. That's the simple explanation. So if you cannot get out of bed, you cannot function, you cannot go to school, you cannot go to university, work, it should be a red flag. Cramps, sure, it's definitely a thing, but it should not be impacting your quality of life. So causes of why one experiences dysmenorrhea is a chemical called prostaglandins. And prostaglandins are chemicals that cause the uterus to contract, to dispel and shed that uterine lining. So it serves a purpose. But when it contracts, it causes vasoconstriction. So the vessels all in that area constrict. And this is what's responsible for the terrible cramping, also responsible for period poo. If you know, you know. But yes, now endometriosis is a very common hormonal condition where the endometrium, the inner lining of the uterus, this is a condition where the tissues, similar to the endometrium, are found outside of the cavity. So you might find these tissues elsewhere in the body. And this misplaced tissue thickens. So it can happen not just when one menstruates, but also just throughout the cycle in general. It's very receptive to hormones and its environment. And when it thickens, it causes inflammation, pain, even scar tissue outside of the uterine cavity. So endometriosis is a chronic, debilitating condition. It affects so many women. It's actually one of the most underdiagnosed female conditions, actually, because there is no marker. There's no one biomarker blood test that can say, oh, you've got endometriosis. And a lot of girls also underreport their pain, so they don't seek professional health care.
So how is it diagnosed? Just by the level of pain, or how would you diagnose endometriosis?
The gold standard is to actually go inside the abdomen with a camera, and that's called a laparoscopy. That's the only way. You cannot make a clinical diagnosis based on symptomatology. You can sometimes see on an ultrasound an endometrial cyst, but not seeing anything on ultrasound is very common and does not exclude a diagnosis of endometriosis. So the only definitive way currently as it stands is to go inside the abdomen, have an operation. And I mean, that's very, very next level. That's reserved for very extreme cases. So it largely goes underdiagnosed and you kind of just manage the symptoms.
And there's no treatment?
So the first line treatment would be to actually put a patient on an oral contraceptive pill. This does not take the tissue away. All this does is basically stabilize the hormones so that the tissue is less receptive to fluctuations in its environment. You kind of just keep the hormones stable, you chill them out, and you hope that it masks the symptoms of endometriosis, which, by the way, is not only painful dysmenorrhea, painful periods. The symptoms are really, really weird. Like it's pain during sex, after sex, painful urination, painful bowel movements. There's mood disturbances as well. Irregular bleeding, it can have impacts on fertility. And yeah, very painful periods, but also chronic pelvic pain. So as I said, it can happen also unrelated to the menstrual cycle. So very debilitating condition. And yes, first line treatment would be to go on an oral contraceptive pill. Second line treatment, failing that, would be another pill, which can just help stabilize the tissue. And then third line treatment would really be to have a diagnostic laparoscopy, go into the abdomen, and if there is any scar tissue and adhesions, take them away. But very complex condition.
So I think it sounds like endometriosis is an exceptionally debilitating disorder that sounds very common and that a lot of women are facing and often goes undiagnosed. And you mentioned so much. So you've spoken about the period duration, the time, the flow of the period, the time between the different cycles, or, you know, the discrepancy between the length of a normal cycle that you may have. And you've also spoken about pain, right? And what's normal in terms of pain levels. And what about not actually the period itself, but during, for example, the luteal phase, when you have PMS. What is normal there? Why do we have PMS? Is it because of the fluctuation of the progesterone, of the estrogen? What's normal? What's not normal? And also, a lot of people think, oh, I have my period, I'm feeling really down, my mood is I'm feeling really like I'm crying at movies and stuff like that. But PMS is actually during the luteal phase, if that's correct, right?
Yes. The second half, the luteal phase, correct? Yeah. So basically, let's just define PMS and then PMDD, something that I definitely suffer from to a very mild extent. Okay, so what is PMS? PMS stands for premenstrual syndrome, and it refers to a group of physical and behavioral symptoms that occur in a cyclic pattern. So, as you correctly identified, in the second half of the menstrual cycle. Symptoms of PMS, the physical symptoms of bloating, breast tenderness, fatigue, headaches, and then as well as the emotional, psychological symptoms like depression, anxiety. So PMDD stands for premenstrual dysphoric disorder. This is just the severe form of PMS. So it's almost like on a spectrum. You've got PMS, where one might report 1 to 4 symptoms. But in PMDD, there's at least 5 symptoms to make the diagnosis, plus one of the affective symptoms, so the psychological symptoms. And this is characterized by severe mood swings, anger, irritability. These are typical symptoms that mark the PMDD diagnosis, and it's very, very debilitating, very serious actually if it's not managed properly.
And maybe a personal anecdote. It's also very much why we started this podcast to discuss these things, but it's actually with thanks to you. I still remember being in the car with you and I was talking about my PMS and how it just didn't feel normal, like I'd get severe headaches, I'd get migraines, I was throwing up the week before, like extreme debilitating nausea, extreme debilitating fatigue, feeling just very, very, very depressed, anxiety like through the roof. And then all of that, bam, would pass the minute I actually got my period. And I remember actually speaking to you and saying, you were a medical student at the time, and you went away and you said, hang on a second, that doesn't sound normal. And you went and looked into it and said, I think you have PMDD. And I remember I was living in London at the time and I went to go speak to a doctor. And she said, yeah, like you have all the textbook symptoms, you classify for this. And I mean, she was very dismissive and was like, oh, well, you can go on Prozac, basically, which I didn't do.
Antidepressant.
An antidepressant. And it's just crazy, like how dismissive it was. But really, that was very much a light bulb moment, because sadly, I knew like what I had and that it wasn't just all in my head, right? But just helping to know and to have a diagnosis of PMDD honestly really changed my life, because it was having an impact on relationships. Now I know, and you feel down and you say, okay, well, this is PMDD. Yes, it's bad. Yes, it's debilitating, but it will pass in 2 days and it will be okay. So I'm really keen to raise more awareness about PMDD, and I think it's very important that you do speak to your loved ones about it and also explain and let them understand it's that time of the month. I have PMDD. Like, just give me a little bit of grace at the moment. I need a little bit of space, and I would retreat into myself. I would be very conscious of my social plans and stuff like that.
Absolutely. And also just being aware that you don't have to live with this. You can check in with a healthcare professional who hopefully isn't dismissive, who can address these symptoms and offer different treatment solutions. So there is treatment for PMDD. Firstly, one must distinguish a primary mental health disorder. So basically confirm that this is occurring cyclically. So 2 weeks before the onset of your period. Because if symptoms occur following menstruation, well, then you know that you're sitting with a different diagnosis here. You're sitting with a primary mental health disorder, like depression and anxiety, right? But if you can tease tease it out and make a diagnosis of PMDD, then one could be prescribed an SSRI, so an antidepressant, an anxiolytic, which one can take cyclically. So you take it in the 2 weeks following ovulation before you have your period. So it's important to also be in tune with your menstrual cycle. I mean, there's also nutrition, the role of exercise. They all have roles to play
So
as
let's
well.
actually get into that. Like in general, for the menstrual cycle, you've got cycle syncing and all of that. Is there any scientific backing to changing your exercise routines? Because I also appreciate that in different times of your cycles, your body temperature changes, so much also happens, your energy levels change. So it does make sense, right, that you would adjust your exercise routine or your diet maybe according to your menstrual cycle. But is there any scientific backing to that?
I love this question so much. Okay, let's divide it up. We've got nutrition and we've got exercise. Should we tackle exercise first?
Yeah,
let's do it.
Mustard.
So current evidence shows that there is no influence on a woman's menstrual cycle phase on her ability to perform, so her strength, her power in the luteal phase, which was previously thought. So it was previously encouraged for women to not work out as much, take it easy, do restful, mindful, slow movements, which is fine. I mean, that's okay if that's what serves you, right? If that's what you feel your body needs to do, that's perfectly fine. But there's no evidence to suggest that if you're not experiencing those symptoms and you are keen to exercise, go for it, because your ability to perform in the luteal phase is just as effective as in the follicular phase. And then the menstrual cycle phase similarly does not influence muscle protein synthesis in weight resistance training. So it was also thought that in the luteal phase, you exercise, you weightlifting, but like what for? You're in the luteal phase, you're not going to generate muscle. That's all false, completely false. So you absolutely can exercise, and you should exercise throughout the cycle. Don't cut your exercise by 50%, because then for 2 weeks of the month you're not exercising, and that's not good. So if you feel like it serves you, go for it. Exercise has been shown to reduce dysmenorrhea, so the painful periods, and physical activity should be encouraged in the luteal phase and subsequent the menstrual phase as tolerated.
Okay, so basically, if you're feeling up to it, exercise, it will actually do you good.
Yes.
There's no scientific backing behind the fact that you should be syncing your exercise routine to your cycle.
Yeah, there's quite a lot of studies into the exercise space, but the area that is a little bit more conflicting is nutrition. So here, studies are ongoing. I'll tell you what we do know. But before I do, I'd actually like to introduce the topic of seed cycling very quickly, because it's all over my social media. And I do feel like women should be empowered to know the concepts and then at least make informed decisions pertaining to their health, right? Have you heard of seed cycling?
I have heard of seed cycling.
So we've got, remember, the follicular phase and we've got the luteal phase. So in the follicular phase, it's encouraged for women to eat more foods that support estrogen production. So for example, flax seeds, pumpkin seeds. These are the two seeds that should prevail in the first half of the cycle. And then the second half of the cycle, so in the luteal phase, one should stick with sunflower seeds and sesame seeds, because that supports progesterone, which, as we know, governs the second half of the cycle. Now, there's unfortunately no evidence to suggest that this actually can help regulate cycles. But just because there's no evidence at the moment doesn't mean that there aren't studies ongoing. And I think it's a very exciting space to explore. And I don't want to be one to dismiss it.
Like I'm all for incorporating nutrition, but with seed cycling, I don't know. I just feel like you would have to eat such a large amount of these seeds, right, to be able to warrant an impact on the body. But maybe, I don't know. I'm certainly not a nutritionist, so
no, and as am I. I'm also not a nutritionist. But what I'm concerned about is that women who have imbalances that need addressing are turning to this method, and they're not correcting their hormone imbalances. So I just fear that if you are someone who experiences irregular cycles, please first check in with a healthcare professional, identify the issues, work with the professional, and then use seed cycling as an adjunct. But let's explore the space. Let's see. I've got my eyes peeled. I'm looking at this because I really like the idea that one can eat for their cycle, and that we know nutrition plays such an important role. But definitely empower yourself, learn about all the different modalities, see what works for you. If you want to be in tune with that regular cycle, use it to support that regular cycle. The issue comes in when you don't have regular cycles and you're using nutrition alone to help correct that. Just please be careful.
Well, I think we have covered so much today. So spoken through the menstrual cycles, why we menstruate, how this works from an evolutionary standpoint, what's normal, what's not normal. I think there's so much more to dig into. I think we've covered a whole bunch today, and hopefully that also sheds some light on what women can anticipate during the menstrual cycles. Also check in to see maybe if you need some additional support, and hopefully can find a good holistic approach to support you. But yeah, very important conversations. I think it's very important to empower women to know about their cycles and understand what's going on in your body.
Absolutely. And there's actually so much more to still be said. I don't even think we've scratched the surface. It has been really amazing chatting. And I'm just so excited for girls to empower themselves and learn about their menstrual cycles and their norms. And yeah, also ways for females to recognize ovulation, because there are very much physical cues. You can track your basal temperature, you can track your cervical mucus. There's actually so much more to talk about. We'll unpack that in our future episode on fertility. Very much looking forward to chatting about that. But yeah, Em, thank you so much for this conversation and just shedding light on this really important topic.
Thank you guys so much for listening in. Please do subscribe and also follow us at the Ovarian Club on Instagram. Let us know if there are any topics that you really are dying to hear about, or if you have any questions. We love hearing from you.
The Ovarian Club, powering life, nurturing health, shaping sustainable wellness. See you soon, follicle friends.